I am Erin Blackwell, and I'm an oncology certified registered nurse at Levine Cancer Institute in the Adult Hematology Leukemia Stem Cell Transplant Clinic. I've always known that I was going to be a nurse. I've known since the time I was a little girl that I enjoyed talking to people, I enjoyed working with people, and that's what nurses do. Every day when I wake up, I look forward to seeing my patients. My day usually starts at 7:30. I will see what patients are coming in, and I always pull their chart from the last time they were here, make sure that everything that should have been done actually happened. It's critical that we have lab results because that could entirely change the conversation for a patient. We do not have a triage nurse, so I am also that, making sure that our patients are taken care of. My favorite time is when they're in clinic and I get that one-on-one time to really see how they're doing. I think it's very important to build a relationship with patients because they are going to share things with you that they may not have shared otherwise.
I'm good. How are you? Doing all right?
Good.
Okay.
And it's funny because those little tidbits that I get from patients are usually the most important information that we glean from an entire visit, and it's because of that trusting relationship. It wouldn't surprise me if he wanted you to come in before we see you again in a month.
My nurse, Erin, she is fantastic. She tells me how my blood work is going, and she always has me coming to the doctor at the proper time. She's always there for me. She is such a wonderful person.
We need your white count before I can let you go home. Okay, 10.5.
What?
Yeah.
That's fantastic.
They're more than a medical record number. They're human beings with lives and social situations and experiences that it's really important to understand to help better personalize their care. Working with the patients and their families or their significant others, their care partners, we really become a work family and a unit, building these relationships. And it's really neat for me because not only do I usually get to know the patient pretty well, almost always I get to know their families. And oftentimes I'll even hear from their family members in between appointments when things are going either really right or really not right.
Well, good. Then I have the pleasure.
The diseases that we work with are really serious, and the public, I don't think, realizes that. The better educated patients are, the better quality of life they're going to have because they have an understanding of what tomorrow looks like. This is how we can treat it, this is how we can move forward, and this is how we can keep their day-to-day as normal as possible. We talk about what nurses do for our patients, but we don't talk about what they do for us. And they are tremendous examples and inspiration. It's because the patients are the best patients in the world.